Exercise, nutrition, and sleep are the foundations of health and wellness, and an expert team can help you along your weight loss journey. Eric Stanek, Chief Medical Officer of DoctorsNow, is here for today's Hello Health, and we're talking about the foundations of health and wellness. I said these sound simple, but can be hard, but they do lead to weight loss.
Yeah, 100%. It's the stuff that almost everybody knows about. It's just a matter of cultivating good habits over time and prioritizing those things in your life, right? Nutrition, exercise, sleep quality, stress management. Those are the things that you want to try to optimize those as best you can and build consistent habits over time. And if you do, then it leads to weight loss and improvement in other health metrics over time.
And what is the hardest one you find that people struggle with? Stress, sleep, or eating?
That's a good
Probably
question.
all of them.
I would say the number one is probably stress management. There's a lot of people that just get easily overwhelmed by the responsibilities of day-to-day life, and a lot of times their health goes on the back burner because of that. And so the frame shift that we try to instill in people is put your health as your top priority. And there's a lot of good downstream effects that come from that, not only in your overall health, but also other aspects of your life too. I think stress management is the most nuanced of all of those. But of course, it all requires you to change your habits and your day-to-day life if you want to have success, and then hopefully be able to sustain that over time.
And why do, especially nutrition and exercise, why do those all work together to lose weight?
Well, it is what we offer is a medical weight loss program, and so obviously those two things are going to be vital if you want to have success on the program. It's tailored individually to each patient. We have a lot of patients that are on medication as well, but the thing that we try to instill in everybody when they first start the program is there's no magic pill, there's no magic shot. There are behavioral changes that are going to be necessary if you want to achieve the results that you want to achieve. When it comes to nutrition, it's all about being in a calorie deficit. Again, a nuanced conversation, and we take time to work with patients on that, but you want to be able to burn more calories than you're taking in on a day-to-day basis, and that's what helps people to lose fat. In terms of exercise, it's the ability to incorporate both strength training and cardiorespiratory fitness into your weeks. If people are not exercising at all, then just going from 0 to 20 minutes 3 times a week makes a massive difference, both in terms of your ability to lose weight and your basal metabolic rate, but also in your cognitive function too. People notice that they are feeling a lot better just by incorporating a little bit more movement into their day-to-day, week-to-week life.
And how does this improve overall wellness or other health metrics? There's
a lot of good things that can come, but just by incorporating these things into your life. When people go to their primary doctors, they usually get a set of blood work every year, and most of the blood work that is obtained is metabolic markers that can be improved through these health and wellness tricks that we talked about. So if you think about your blood sugars, for example, people who have pre-diabetes, diabetes, a lot of times that can be reversed without medication just by restricting carbohydrates, being in a calorie deficit, improving lean muscle mass. You can see those changes be made over time. Triglycerides, free fatty acids, those are based a lot on nutrition. You can see those improve with changes in nutrition. A lot of people have sleep apnea as well. That's something that's very concurrent with obesity, and by treating sleep apnea, you can improve obesity, but by improving obesity, you can also treat sleep apnea as well. That leads to better sleep quality, better quality of life. So there's a ton of positive downstream effects that come from prioritizing health and wellness.
And we're almost out of time, but tell us what the first appointment, what can we expect for the Medical Weight Loss Clinic?
Yeah, so for your initial consultation, we start by getting a body composition scan that shows us not only your weight and your BMI. You can get that just from a scale alone, but you can see your lean muscle mass, subcutaneous fat mass, visceral fat mass, which we don't talk about but is extremely important. You can see your basal metabolic rate, and we're able to track those metrics over time. You meet with a board-certified physician or provider, and most of your initial consultation is centered around health and wellness. Talking about exercise, talking about sleep, talking about nutrition. These things are all very important. And then we have the conversation about medication. And some people are using medication to help them achieve their weight loss goals, but other people elect for health and wellness alone. So we try to meet patients where they're at, and then we just go on a month-by-month basis from there.
Well, thank you so much for sharing this. A lot of people thinking about this as we head into the holidays, so we appreciate it.
Yeah, thanks for having me.
And you can learn more. Go to DoctorsNow.com or call 515-471-1860. You'll find locations in Altoona and West Des Moines, and you can see more on social media.